Hey everybody, my name is Dr.Robb Jr. I'm a double board certified facial plastic surgeon based in Atlanta, Georgia, and I want to talk a little bit about coronavirus and what's going on, how this affects the body. I've been asked by friends, family, patients, how this interacts, how this actually hurts us, how this ends up sometimes killing people. And so I wanted to talk about that. And right now, you're probably thinking, why in the world is a facial plastic surgeon? Um, what do they know about coronavirus and that kind of thing? Well, great question, and that's fair. Before I was a facial plastic surgeon, I was a head and neck surgeon um, and I dealt a lot with upper aero, meaning airway issues. And so I was an airway surgeon. And so the coronavirus affects the airway. So, first thing, kind of starting off with my background, I went to med school. I've got the diploma back here if you care. But I went to med school at the Medical College of Georgia, which is the medical school in the University of Georgia system. We are quarantined here, so the rest of my diplomas and board certifications are in my office. And so we're in my home office right now. But starting out kind of with the coronavirus and how it infects you, the coronavirus is a family of viruses that I learned about in med school a long time ago. And so what this specific virus is COVID-19 or SARS-CoV-1, which is SARS is SARS, which stands for Severe Acute Respiratory Syndrome, much like SARS that I think came out in like 2003-ish. And so COVID-19 is coronavirus family disease 2019 is kind of when it started. So that's where that name comes from. And a quick little bit about how it affects you or infects you is that, and this is the best that we can tell right now, and I'm synthesizing information that I've learned from other physicians as well as my friends on the front lines who are treating this in the ICUs in the United States, but also Italy and across the world. And so basically this, we believe, spreads through respiratory droplets. So somebody sneezes or wipes their mouth who is carrying the virus, and then either those droplets land on you or in you and go in your nose. But eventually they have to make it into your mouth, nose, and we think eyes. So that's why you're hearing a lot about hand washing and you're hearing a lot about 6 feet between people, because the respiratory droplets, we believe, can travel up to 6 feet. So that's why, in theory, if we're over 6 feet away, then we are, in theory, at a safe distance. But use your own judgment on that. And so if these droplets are on your cart at the grocery store, she's an expert in this as well, but if these droplets are on the cart in your grocery store and you touch your cart without cleaning it and then you rub your nose, then you could have just gotten the viral particles inside your nose. We believe that the virus central system is actually, the viral load is heaviest in the nose. The beginning of the coronavirus or COVID-19 testing was done through a long stick that was placed in the front of the nose that went all the way to the back, which is called the nasopharynx. It's like this far back. And that swab was done there. But through recent testing, through a company that's, I believe, maybe even housed in Atlanta, that we found that the viral load was so heavy in the nose that no longer does the swab need to go all the way to the nasopharynx. It can actually just be done in the beginning, in the very front of the nose. Now that was revolutionary, because if you are swabbing people in the back of the nose, they're coughing, they're gagging, in some cases vomiting on the testing people. So when you're talking about PPE or personal protection equipment, that becomes really difficult if you're having a change with each patient. Okay, so the virus gets in your nose. Ultimately, it makes its way to your lungs. And this is really where things start to happen. So I drew a very rudimentary drawing. I've never been called an artist. But this is what happens if you can look here. This is our windpipe here. And when the virus gets down into our lungs, what we have in our lungs is actually the mechanical system of transfer of air and oxygen into our bloodstream is done through what's called the alveoli of the lung. So within that alveoli, there are cells that produce what's called surfactant, which is kind of like, almost like a soap, which gives good surface area and pliability to our lungs. But on the type 2 pneumocytes that produce surfactant, there's a receptor called the ACE receptor, ACE, which stands for angiotensin converting enzyme. COVID-19 attacks the ACE inhibitor. So when COVID-19, or the ACE receptor, sorry, not the ACE inhibitor, when COVID-19 attacks the type 2 pneumocyte, essentially what happens is this cell kind of says, oh, things are crazy here. The cell dies. Dead. One little tiny cell in your entire lungs dies. Not a huge deal, right? Right, kind of. So what happens then, after it dies, the body is responding to this cell that died, and this creates inflammation. Crazy amounts of inflammation in your lungs. And so you have a bunch of immune modulators that is your immune system looking out for this kind of stuff, but it notices something isn't right. The little bells and whistles in our body go off, and all of these cells are recruited from around the body, go to our lungs, okay? This creates fluid in our lungs, where we are not supposed to have fluid in our lungs. And so when the fluid shows up in our lungs, and this fluid is like debris from the skin cells or from the pneumocytes that are dying. It might be some pus. It might just be some body fluid, some nastiness that's not supposed to be there, is the bottom line. Fluid in our lungs is generally called pneumonia. You might have heard that term, but now we start getting into the things that aren't so great. So when pneumonia occurs, essentially the lungs, which are these sponge-like, very compliable, open system filled with air, are now filled with fluid. And if they're filled with fluid, then you're not going to get that oxygen transport into the bloodstream. Okay? If this gets to such a degree, then you start losing your ability to put oxygen in your blood. And if you lose the ability for oxygen to be put in your blood, you start affecting the other organs. And so starts to get kind of to the bad stuff. A couple other things that we are learning from Italy and New York City and different things like this is that most patients do fine with this, are young and healthy. We're learning that patients with a pre-existing condition or another, what we call comorbidity, which means they might have smoked in the past, or they may be of advanced age, which they're calling over 60 years old, which is not old. And this affects a lot of my patients as a facial plastic surgeon. So we have obviously shut down the office and just are keeping our patients safe. Now, a couple stats that I want to share are anecdotal, which means they have not been studied, but this is stuff from my friends who are on the front lines. So it's really important to listen to the recommendations and in some cases the mandates of social distancing. So we're saying right now, approximately 70% of patients who require a breathing tube and a breathing machine do not survive COVID-19. That is a really, really not good statistic. And that was 87% of patients who required a breathing tube in Italy were not able to survive. And so our numbers are a little better than that, but still 70%, if you require a breathing tube, do not survive. Again, these are mostly patients who have other medical problems and other issues, but that's a significant number nonetheless. Other things that we're learning is that for my ENT surgeons out there, the heavy viral load is in the nose. And so there was a case in China where a patient with COVID-19 had an infection, had a sinus surgery. It was actually a surgical approach that was going through the sinuses to get to the brain, and all 14 people in the surgery room, in the operating room, became infected. And so this just kind of highlights the extreme transmission and easy spreading of this virus. So that is that. Now, if you believe that you have this virus, symptoms, as you probably are well versed now, fever is kind of the mainstay. So pretty much every patient will get fever at some point. It might be a low fever, might not even be noticeable to the patient, but a lot of patients, the majority of patients are going to have fever. Cough, whether it be dry or productive, sore throat. Now we're learning something like loss of smell might be associated with coronavirus, acute infection, body aches. I've had an ER friend say even back pain, and vomiting, upset stomach, nausea, all of these things. And these are kind of non-specific findings, but the big ones are this cough, and the fever. Now, perhaps the scariest thing about transmission of this is that you can shed the virus, meaning you can spread the virus to others for up to 14 days without even knowing you're infected. So you picked up the virus at some point, you went along with normal life saying you feel great, that's so silly, I don't need to do any social distancing. And in those 14 days, boom, you just infected who knows how many people. And so that's one of the reasons why this is bad. Now, you may be thinking that, oh, I heard of Ebola virus in the past, and that's a bad virus, and that's a bad one. This one is nothing like that. And you'd be right. The mortality rate from Ebola virus is much higher. But when you think of pandemics and spreading of disease, Ebola virus is such a virulent, deadly disease that it kills a lot of its patients before they can even spread it. And so that's not a great design in the viral world for spreading. This guy today, COVID-19, is not a good player for that because it is infecting a lot of people before they even know that they have an infection. So it's very important to stay in your house. When you go out to do whatever you need to do, wear gloves, wear a mask. There's new literature that I just saw in the last day or two showing that masks do help. The N95 masks, which you may have heard about, these are the kind of the airtight masks, which can basically shield us from all respiratory droplets or most respiratory droplets. But any mask that you can get your hands on is better than no mask because this can stop some droplets, but more than anything else, it keeps you from touching your face. And so that is a significant thing. Also, when you wear gloves, be smart about it. Just because you have gloves on doesn't mean you're not picking up the virus from here and putting it over here. So if you have gloves and you put your gloves on after you get out of your car to go into the grocery store, when you are getting back in your car, take the gloves off so that you're not going to infect your car with anything that you picked up in the grocery store. So the current, today is April 1st, and the current models show us peaking sometime end of April to May 1st. And so hopefully life will be kind of back to normal in the middle of June to early July. We are thinking that if you get infected with coronavirus, that you will not be able to be reinfected. This is early, but there was a study done with primates, and after they got their initial primary infection, the researchers were not able to reinfect the primates. And so that is good. The other thing that you may have heard mentioned is called herd immunity. And basically that means that when enough of the population either has been exposed to the virus and cleared it, or if they create a treatment or a vaccine, then we'll be able to kind of, the herd will be immune and it won't really catch steam and spread again. This is a huge, really important, obviously unprecedented time, but it's a great opportunity to remind everybody to get your flu shot, to get your vaccines, because essentially, now we have no vaccine for this, this is a new virus, but these things, viral pandemics and massive spreading of disease, is significantly reduced, and the literature has borne this out, when we have vaccines and when the herd, when the people get vaccinated. So cannot stress that enough. We have vaccines for a lot of this stuff. And then I am happy you guys can post questions. I am totally available. Oh, so scary. So I'm happy to answer any questions, but most importantly, me and my family are praying for our country, for you and your family, and for our entire world and nation. And my recommendation is, during this crazy time, spend time with family, enjoy it. I have no control over it, so I'm just kind of surrendering. And so I suggest that you do the same while being safe, while practicing social distancing. And thank you so much for watching.